Well, let's return to the grim milestone that over 60,000 people in the UK have now died within 28 days of a positive COVID-19 test. In the latest figures released by the government, the UK has recorded 14,879 coronavirus cases and 414 deaths in the past 24 hours. This takes the total number of deaths to 60,113. Only the US, Brazil, India and Mexico have recorded more deaths than the UK. That's all according to the Johns Hopkins University. Well, we can speak to Devi Sridhar, who is Professor of Global Public Health at the University of Edinburgh. And it's good of you to join us. It is a stark day for this country. What do you make of where we are, given that back in April, the worst case scenario that the government was discussing was 50,000 deaths, and now today we pass 60,000?
It's absolutely tragic. I mean, to have lost these many lives, but as well to be facing one of the largest economic hits in Europe, to have spent the most on the response. Something's clearly not gone right, and I hope that there will be a time to look back on these months and think what decisions were made and how could they have been made better so we never have something like this happen again.
So we've got the fifth highest death rate in the world. How do we compare? What's your assessment of how we compare with other nations?
Well, it's pretty poor. I mean, look at different regions. You have East Asia and the Pacific. They've taken very few deaths and, the low hundreds, some even less than that in the dozens. You look at the United States, that's been a complete mess, as we've seen under President Donald Trump, and a completely uncontrolled epidemic in several states. Brazil, a similar story. And then African countries have done pretty well given how low resource they are. And so it's really Europe and North America that have taken the largest hit from this pandemic and are struggling with both their health issue and their economic issues as well.
So when we look at especially some of those Asian countries, Vietnam, Singapore, not least Taiwan, what were they doing that the UK, the US haven't been doing?
Well, they actually did three things very simply. They treated this like a SARS-like event, an event that you could eliminate this virus. They did not want to live with the virus. They wanted to suppress it to the lowest possible levels so they could open their economy fully. And they did this through first monitoring their borders. Secondly, having really good test, trace, isolate from the start, and isolation, making sure people actually isolate when they're positive. And third, offering good guidance to the public about why you don't want to catch it at any age and how to avoid it. And it's just, we seem not to be learning our lessons because our test and trace and isolation system isn't working. There's mass confusion of whether you should or shouldn't get it if you're young or old. And even today, you see the government announcing a policy that if you're of a certain elite category, you don't need to isolate when you enter the country. And it's absolute madness that we locked people in their homes in March and April, but we kept our airports open. And then we encouraged people to go abroad on holidays. And then now, again, we're having certain categories of people that if you're rich enough, you don't have to quarantine. And it makes no sense, actually, from a scientific perspective. And so it's really simple to look at what they've done in East Asia and then think, what can we adapt here?
And when it comes to the age of a population, how does that compare? How does that impact the way that a country is dealing with this or not dealing with this?
Well, of course. I mean, if you have a younger population and healthier population, it helps because we know the risk factors for this are, being elderly, but also being overweight, having diabetes, asthma, hypertension, as well as coming from a deprived background and your kind of socioeconomic status. So inequality really kills in this sense. And so those countries that have managed to deal with some of those underlying health issues have done better. But it doesn't get away from the fact that the more cases you have and the more community spread, the more illness you're going to have and the more deaths. It's impossible to have one without the other. And that's what we've seen in Brazil and the United States as well, just huge numbers of cases, which unfortunately at some point will translate into hospitalizations and then sadly deaths.
And now we're talking about the UK being the first country to start rolling out, to approve a vaccine. We've got the Pfizer vaccine that we've been so optimistic about. What kind of role do you think that will have in potentially reducing deaths? How hopeful are you?
Well, I'm really hopeful in that regard because this vaccine has been trialed, the Pfizer one, in over 40,000 people, and there was no serious adverse effects, and it's very effective at stopping severe COVID-19. And that's what we need right now to prevent deaths over the next coming weeks and months. We're currently running a very high level of infection. We have a couple hundred deaths a day. And so I understand that time was of the essence, speed, because every day they delayed making a decision. The cost was lost lives. And so if they can get that vaccine out to the people who might have been infected in the next couple of weeks and a couple of months and prevent them dying, I think it's quite positive for the next few months to get us through this rough period before we can form a more sustainable suppression strategy.
Professor Devi Sridhar, fascinating to speak to you from the University of Edinburgh. Thank you so much for your insight. Thank you.
Thank you.